and we are going to move into a story that's actually a two-parter, and it started last night on One News. And the reason we're going to have a good look at this right now is because actually I'm not going to. It's not that we're not going to give it its due credit, but we've got quite a significant conversation to come around Chris Bishop and Q&A as well. So let's have a quick look at this first, though. This is what's happening in Nelson. We here in Dunedin have a bit of a vested interest in, how our hospitals are being treated. We often now speak to Dr. Gary Pienda. He explains to us lots of things like how there technically isn't a hiring freeze because the government can say there's no freeze on hiring because they're hiring 2 people when 45 are needed. We're getting more and more stories coming out as to how this government has now. Look, this is a fair way of saying it. Our health system has been struggling for a long time. This is a systemic issue for a long time. Mm-hmm. But most of these health professionals that will tell you that this government have poured jet fuel on the problems. So yes, no one's clear of the responsibility of this program, but this current government is responsible for ramping up exponentially high. Let's have a listen.
Patients' lives have been put at risk at Nelson Hospital. That's according to some of the facility's most experienced doctors. Tonight, One News gets an exclusive insight into their heavy workload and limited resourcing. While many healthcare providers are under pressure, Nelson Hospital has the worst wait times for first specialist appointments in the country, which Health New Zealand has called unacceptable. The obstetrics and gynecology department has more than 1,000 people waiting for a first appointment.
And remember, gynecology was one of the situations that we talked about up north as well with Gary, his colleague. It's massive. The gynecological services aren't well catered for in this country at all.
Follow up. Jessica Roden is with us live in just a moment with more details and reaction. First, here's her report.
Amy Atkin has been in serious pain for the last 3 months.
So it's down in the lower stomach here, and it just feels like I've got a sharp knife that's being twisted.
She can't work, is taking morphine, and regularly returns to the emergency department.
This is also true. I don't understand this. She can't work. So, not to sound like a capitalist, but get her fixed up and send her back to work. But in reality, if you can't work, probably a sickness benefit, I'm guessing, more power to you. Absolutely need it. As many people need to be on it as they can. But a good business practice would be to get those people back into the workforce. Therefore, you get them into their medical issues sorted out as quickly as possible. But it seems that the health system in general, and like I said, jet fuel today, has been let these people wait. Oh my gosh, look at the bill that we've got for people on benefits. Yeah, well, let's get them off benefits by helping them with their surgeries to get them back into the workforce. It doesn't seem to, that logic doesn't seem to fall with pretty much any government, but this one in particular.
I can't do much through the day. It's taken over my life effectively.
Her story's upsetting, but it's not isolated. This is the head of Nelson's obstetrics and gynecology department, and Amy is just one of many on her wait list.
We have over 1,000 patients that are waiting for either a first specialist appointment or a follow-up appointment. I've never seen that number of patients waiting to be seen.
480 of them have been waiting for more than the 4-month target timeframe. The longest wait, now almost 2 years, and that can lead to complications.
The first one that we worry about the most is needing an emergent hysterectomy.
Saying that's not as safe as a planned operation.
That is genuinely a life-threatening situation, and that's the situation we have found ourselves in more times than we would like.
It should never happen.
Yeah, I can't think of a time in my career outside of the last 2 years.
Can I just offer something? Because I've just looked it up, so I would have had it earlier. I'm sorry. They say there's 1,000 people on that wait list for gynecological issues. Obstetrics and gynecological issues. So in the Nelson-Marlborough area services 150,000 people under their DHB. So there's 150,000 people in the Nelson-Marlborough DHB. 1,000 of them, that's like 0.75% of the entire population are waiting. That is a huge number of people out of 150,000 people. If it was out of 3 million, you'd go, no, it's a small percentage, but it's out of 150,000 people. 1,000 people on that wait list, let alone all the other ones. It's huge.
We're a seen or done an emergency hysterectomy for the reasons we're now seeing and doing them.
There's always patients that deteriorate for whatever reason on our waiting lists. That happens right across the world. Is there a new trend here? Is something that we're looking into.
Their department isn't the only one struggling. Daniel Walker is still recovering from a surgery that doctors say...
Fair wise say trigger warning, by the way. Probably a bit late because there's the scar, but it's pretty graphic.
could have been avoided.
And they had to get the lymph node over here.
He had a swollen testicle last year.
My GP had done it as a urgent cancer referral, and they had changed it to a right painless testicle, basically. So had downgraded my diagnosis.
He should have been seen in 2 weeks. It took 9. And during that time, the cancer spread.
The old Daniel died in that chemo, in that whole process, and that this new Daniel now is someone that I don't recognise.
It just, my mind boggles why he waited that period of time.
Dr. Suzanne Boker says over the last 2 years, extended leave of senior doctors hasn't been covered, and the urology department waitlist has soared.
Many patients that have been triaged to be seen within 56 days are waiting in excess of 9 to 12 months.
On occasion, it's left her in tears.
And certainly I've seen patients that I believe their disease has gone from curable to incurable during that waiting time.
And many aren't even making it onto the wait list.
If you've got a cancer or an organ-threatening condition, you'll be seen in our urology service, otherwise you just won't be seen.
Private specialists were recently flown in to help clear the urology backlog. The doctors and their union...
Paid for, remember we had this chat with Gary, paid for by the public money. Remember, Gary Payenda made this very clear. Basically, one of the reasons, one of the ways the private sector survives is on the public dollar, public money going into it. There's an example of it. 50 million about to go to get rid of a backlog of surgery wait lists. Public money paying private specialists.
Association of Salaried Medical Specialists have been raising these issues for months, if not years. Nelson's now the worst in the country for first specialist appointments.
That's unacceptable to me and to the clinical teams, and clearly not okay for the community.
He says some roles advertised couldn't be filled, but that more doctors could be on the way.
We won't be able to do everything immediately, so where is our greatest risk? And clearly Nelson's going to be a key feature.
Management has suggested working weekends, delaying follow-up appointments and only doing emergency operations.
So I'm sure that won't hurt the system at all. Delaying follow-ups, that sort of thing, I'd be fine.
To get through the wait list.
What do you think of that suggestion?
It'll get the patient seen, but
Not treated.
not treated.
Amy has been told it'll be a year before she's seen.
If you were to get your first specialist appointment tomorrow, how would that feel?
I'd be amazed. I'll be so happy just to have at least a plan.
A plan to get her life back on track.
There you go. That's the story. And just because some people in the chat have questioned the Nelson Marlborough thing, let me just read out the stat that I read. Health New Zealand, Nelson Marlborough serves approximately 150,000 people across the Nelson, Marlborough and Tasman regions. I think someone in the chat said there was another 170,000. According to this, which is from goforgood.nz, 150,000 is Nelson, Marlborough, Tasman. That's who the DHB services. Chewie.
Now, I can't talk about the Nelson Marlborough area without making this cheap shot. They've got that huge wait list with a lot of people in that area don't even believe in medicine. So imagine if they all did. The wait list would be much, much longer. Look, this is something that we are seeing right throughout the country. You can swap out the name of the area if you want. Both of my parents have gone through Timaru Hospital in the last 6 months. I have a friend there that works in admin at that hospital. The comments that she's had about the lack of IT support has disappeared, paperwork's getting lost, people are losing their slots and getting surgery because of admin issues. Now, remember, all of these cuts was dead wood in the back room. We're seeing that. we're seeing what happens when you take out the deadwood, the people that organize this sort of stuff. You know, you can't expect a doctor and a nurse solely to run a hospital.
Yeah.
They end up being asked to clean out bedpans and make beds, and maybe the paperwork will work out, maybe it won't. I think what really galls me with this particular issue is that I also know of female friends of mine that have had gynecological issues and that sort of thing. And the stories that you hear from those women is quite often around endometriosis, hope I said that right, of going through multiple GPs, spending years and years and years going, hey, look, I don't think this is normal. I'm in crippling pain. I have time off work once a month. And just being told, every woman goes through that. You're just blowing it out of proportion. Spending years and years and years to find someone that believes you. Then you've got to convince them that, hey, look, just take it out. Take the work. I've had 2 kids that didn't fix anything. Just get rid of the plumbing, and I can have the quality of life back. And GP signs off on that or finds a specialist to do that, and then you go into the public health system, and this is what you get. More waiting, more quality of life gone. And if you get to that point where you've got burned out doctors trying their hardest, doing extra shifts to try and get that wait list down because they care about this sort of stuff, but they're burned out, and then you have mistakes happen. That's when you get people having, say, if it was cancer of the testicles, having the wrong testicle taken off. Someone leaves a sponge inside you, sews you back up again. This is where this shit happens. And I think, Pat, you're quite right to identify the fact that in the urge to cut costs, they end up increasing costs to the country. That lost productivity, the fact that people are on benefits and that sort of thing. And actually, there was an excellent clarification here from Politikiwi. There is no sickness benefit. I work at WINS, and could please stop saying sickness benefit?
What's it called?
They're mainly on a job seeker,
supported living,
medical certificate, or supported living. So yeah, we changed the language, but
so supported living. Yeah, sure.
Yeah. And that's the same sort of thing.
For God's sake, stop using the wrong word, Pat. God,
get it together.
It's been a night of using the wrong words, Pat.
But yeah, I mean, this is, you know, you have these people, and then the way that WINS has now been weaponized, right? They could find that information out, or they could just drag this person back into the office every 3 months because we all know that they're faking it and ripping off the long-suffering taxpayer of New Zealand and his portfolio. So
his portfolio, just the one.
It's his
long-suffering.
portfolio.
His portfolio.
Yeah, absolutely. And it's bullshit, and we know where it's coming from. It's coming from underfunding. Like, I keep coming back to this graph. This is the annual health spend change per person in real terms. And we've got big red blocks for the Labour government, pretty consistent. You got Key's national government in there, in the middle. Still a percentage increase, but a very small one. And then you've got our current government, where it is 3% reduction. And that is why our health system is tanking, and it is by design. The government doesn't have any rights to be running a health system. They can't do it efficiently. Look at these huge waiting lists. Look at all the pain and misery. And we're just pouring money into it, and it's not changing anything. Best let someone else have a go, and we lose our public health system.